Okay. Bismillah ar-Rahman ar-Rahim. In the name of God, uh, thank you so much, my dear friends, for inviting me to this amazing session. And I really thank you for joining us for this live session on YouTube. Uh, I really thank my friends for managing this session. I think I should have say a very warm hello to my friends in Russia and especially Sechenov University, if I am pronouncing it well. Uh, we have been doing some uh, arrangements before starting the session. I'm waiting for confirmation of my friends to start the presentation. Okay. As you may have known about the title of our presentation, I'm going to talk about the ICH and IVH following COVID-19 infection. First, let me introduce myself to you, my nice friends. I'm Khosravi, Mohammad Hossein Khosravi, Dr. Mohammad Hossein Khosravi, a researcher and physician in Functional Neurosurgery Research Center, Shuhada Tajrish Comprehensive Neurosurgical Center of Excellence, which is located in Shahid Beshi University of Medical Sciences in Tehran, the capital of Islamic Republic of Iran. Uh, COVID-19, a disease which has affected uh, our all the communities, all the countries, all the world, and COVID-19 is affecting right now. Also, is affecting all the people all around the world. Has altered a lot of uh, functions. Has altered a lot of activities, scientific activities. You know, everything, nearly everything, and the life has not the same manner as before. um, we all have the dream to come back to the days before December 2019. And I wish by discovery of the new vaccines, this could be possible in a really near future. Okay. As I have told you, I'm going to talk about the two cerebrovascular brain events, uh, which are called ICH and IVH, following COVID-19 infection in patients. I've been told that most of the audiences are uh, medical students, I think, pharmaceutical students, pharmacy students, and our dear friends, which are in the beginning of their education course and first year medical pharmacy, nursing, and dental students, as well as other friends. So I decided to start my presentation with talking about the uh, basics and fundamentals of ICH and IVH, have a definition about them, and then we will talk about the ICH and IVH in COVID-19 patients. Okay, as you know, this is a brain which is dissected, and in this slide, I'm going to talk about the types of brain hemorrhage. As you know, our brain is composed of very different and various components, uh, such as cerebellum, thalamus, hypothalamus, and cortex, and you may have know about the different cortexes and different lobes in our brain. For example, frontal lobe, parietal, occipital, and etc. Uh, as our brain is composed from different components, and as any other living tissue, our brain also needs to be fed, also needs oxygen, glucose for uh, doing the daily activities, for uh, having energy to think, to act, and everything other. So uh, every living tissue in our body needs vessels, needs blood vessels uh, to supply it uh, by oxygen and other nutrients in our body. Vessel blood can be teared or injured easily in every part of the body. So brain is not an exception. Also, brain can have bleedings, can have injuries. Vessels in our brain can have injuries and lead to hemorrhages inside the brain. Uh, as you can see in the slide, the number one is epidural hematoma. It's also commonly caused by the veins, which have the responsibility to supply the uh, dura, and are usually caused by traumas to head, by head traumas. Uh, they're not really inside the brain. They're not inside the parenchyma or inside the tissue, but the brain tissue. They usually occur outside the brain tissue, between the bone, between the skull bone and the brain. And the dura uh, itself divides the this hemorrhagic event, epidural hematoma, from the uh, main brain tissue. Other type of brain hemorrhage is subdural hematoma. It's a little bit closer to the brain tissue. Subdural hematoma usually occurs uh, under the dura. It usually passes the dura, and as you can see, it's a little bit closer to the brain. But epidural hematoma and subdural hematomas, if they are not big enough, they cannot cause such problems, such big problems. But if they have a high volume, they can also cause big problems for patients. But we're not really uh, um, worry about the epidural hematomas, subdural hematomas as physicians and surgeons. But as you can see in other parts of this slide, other types of brain hemorrhages are a little bit more important. They can cause severe problems, loss of consciousness, alteration in breathing, and finally, unfortunately, death. So we should pay a lot of attention to these kind of events. Uh, Not all of the brain hemorrhages, intracranial hemorrhages, or as we say ICH, are fatal or deadly, but some of them may occur in parts which are really important for us. For example, the thalamus has the most important role in our brain. It nearly controls every activity that we are doing, every action. When I decide to raise my hand, to shake it, and everything, even talking, is all of them are arranged by thalamus. So you consider a patient with hemorrhage in thalamus. Nearly 80 to 90% of patients with thalamus hemorrhage uh, are going to be brain deaths, uh, unfortunately. But other parts of the brain may experience hemorrhages, uh, which are not really dangerous, but they need hospital care, admission, prescribing some drugs, and uh, etc. Okay, uh, so as you can see, the number three is subarachnoid hemorrhage is uh, completely close to the brain tissue, and patients with subarachnoid hemorrhage, or as we say SAH, usually experience severe headaches. We call them thunderclap headaches. Severe headaches that patients tells us about them. I have not even experienced such a terrible headache. Uh, Usually they cause painful, really painful headaches, SAH, and they are more important than the previously mentioned ones, such as epidural hematoma, subdural hematoma, subarachnoid hemorrhage. And the main point, intracerebral hemorrhage or intracerebral hemorrhage, hemorrhage which is mostly occurred inside the brain tissue itself. It's much important. It's more important than other hemorrhages. So intracranial hemorrhage is a general term, and we can call epidural, subdural, subarachnoid, and even intracerebral hemorrhages as intracranial hemorrhages or ICH. But specifically in this session, I'm going to talk about the intracerebral hemorrhages. Okay, thank you so much for your nice attention. I'm going to move to the next slide. My friends in organizing committee have told me that you may also have some questions. It's really okay. I'm really okay with questions. Whenever you have any questions, talk about it, comment it in the session, and my friends will tell me about the question, and I'm going to answer them very happily. Okay, another term that we are going to talk about is IVH, or intraventricular hemorrhage. As you may know, our brain has some ventricles. Ventricles are empty spaces inside the brain. They have the great responsibility for producing cerebellospinal fluid, or as we call it, CSF. CSF has several responsibilities in the CNS, central nervous system, and it circulates all around the central nervous system, from the brain to the spinal cord and back. Also, as other living tissues, these ventricles need to be supplied by blood vessels. Sometimes these blood vessels, which have the responsibility to feed ventricles, are damaged. Uh, and the bleeding by these blood vessels causes intraventricular hemorrhages. Hemorrhages which are usually occurred inside the ventricles. So it's another type of ICH, intracranial hemorrhages, and especially we call it IVH. Uh, as it has some kind of different and divided part from the brain, ICH and IVH are usually used separate from each other. All the brain and its structures are located inside the skull, but uh, it has it is some kind of contract, and we call these kind of hemorrhages IVH, or intraventricular hemorrhage. Okay. I just wanted to show you the ventricles, their structure, and let me add this that we have four ventricles in our brain, and they have different responsibilities. Okay. Um, in medical research and especially clinical research, we have some kind of articles which are called case report or case presentations, which are usually called case reports. Case reports are, I think, in my idea, the most important part of the medical research. In fact, they are the beginning of discovering new and big things. For example, when the COVID-19 pandemic wanted to start, uh, it was begun by some case of viral pneumonia in Wuhan, China. Physicians and researchers started to report some cases with unusual viral pneumonia. One case, two cases, three cases, and suddenly the whole world, the scientific community, found that uh, there must be something important about these viral pneumonias. And further research and more, uh, you know, acts uh, resulted in discovering the uh, SARS-CoV-2 virus, as the disease is named today, COVID-19. So case reports are really important, and help us to further develop our research in all fields of research, medical research. In fact, case reports are beginnings of the events. We are usually noticed about the new events, new pandemics, new diseases by case reports, by single case reports from every part of the world. For example, from different countries, different continents. So even in pharmaceutical industries, when a drug is FDA approved and is usually prescribed by physicians to patients, uh, it may cause some significant and dangerous side effect. When a patient is affected by one of these side effects or dangerous events, researchers and physicians have the responsibility to inform other communities, inform other physicians that one type of side effects or dangerous side effects has occurred in a patient. Then they should write case reports. And as the COVID-19 pandemic is going on, and as it is affecting more and more people, unfortunately, we may face some more, events. We may face some more changes in our bodies or diseases. I'm going to present you some of these case reports that let us know about the possibility of intracranial hemorrhage (ICH) or intraventricular hemorrhage (IVH) in patients with COVID-19. The first case, which I have borrowed from the case report of Khattar et al., which has been recently published in uh, Interdisciplinary Neurosurgery Journal, and I'm going to present to you this case. Uh, this CT scan in the right side of the slide is contributed to a 42-year-old man. Uh, he had he has had the chronic hypertension as the underlying disease, and he attended the hospital 5 days after He was diagnosed with COVID-19 in an outpatient clinic. Uh, he was complaining from severe cough, tachypnea. Tachypnea means that the respiratory rate, the number of breaths uh, each person take in 1 minute was increased. We have tachypnea or increases in respiratory rate in every variety of diseases, cardiovascular diseases, lung diseases, pulmonary diseases, and etc. So the patient was complaining from severe cough, with severe cough, tachypnea, and unfortunately, when he arrives to the hospital, the pulmonary condition, the respiratory situation starts to get worse. It starts to make patient intubated 30 hours following admission. You may know the uh, meaning of intubation. The patient and tracheal tube is placed for patient through the mouth and the trachea to the lungs, and the tube is connected to a device which is called ventilator, and the device from now on has the responsibility to uh, arrange the patient's respiratory function and respirations. So the patient got intubated 30 hours following admission. Uh, he was admitted into ICU, intensive care unit, on the 16th day of the admission, hospitalization, the patient had high levels of D-dimer, a marker in the blood which shows the possibility of coagulation and severe coagulations of blood in our body. So the physicians started heparin, which is an anticoagulant uh, for the patient. After nearly a week, the patient had bilateral fixed and dilated pupils. When pupils are dilated, it's a kind of sign of damage to the brain. A normal and healthy uh, patient, and normal and healthy people, we have pupil reactions. Pupil reacts to the light. When you shed light on your friend's eye, you may have noticed that the uh, pupil starts meiosis, meiosis, and when you uh, make the light off, and the pupil starts mydriasis or dilation. So when we do not have this reflex, pupil reflex in a patient, uh, we may um, pay attention to the brain events really emergently. So after the physicians found that the patient has bilateral fixed and dilated pupils, they asked for a brain CT scan for patient, and as you can see, uh, there are some white um, attenuations in this CT scan in this slide, in this image from the patient's brain. The white shadows are showing hemorrhages and new hemorrhage in brain. This is a CT scan, computed tomography scan from the brain, and in one of the slides we can see some white shadows. These white shadows are showing recent hemorrhage, or a sign of recent hemorrhage in the brain tissue. So as you can see, the patient uh, had brain hemorrhage, intracranial hemorrhages, and unfortunately, he was diagnosed to be a brain dead patient, and his family decided to no more continue the uh, healthcare and the hospital care for him after about 30 days. Okay, sorry for looking the other side. I should check the questions or any problems at the same time with my friends in Sechenov. Okay, let's move to the next slide and another patient. Another patient is a 41-year-old male patient with history of hypertension, high blood pressure, and type 2 diabetes mellitus. But his hypertension was really good control with the drugs, medications, as well as the type 2 diabetes. Patient uh, attended to the emergency department with cough and respiratory problems, and unfortunately, he got intubated as the previous patient 24 hours after admission, after being hospitalized. And the patient also needed ICU care, intensive care unit care. And after 1 month of ICU care, after 1 month of being hospitalized in ICU, the patient got drowsy with new right-sided hemiplegia. Hemiplegia means the patient uses the movement of limbs, upper limbs and lower limbs of one side of the body, and it is called hemiplegia. Drowsiness is some kind of mental status which is associated with some kind of being sleepy. It's called drowsiness. So all these symptoms are really important for neurosurgeons, for neurologists, for physicians. According to these symptoms, physicians decided to have a brain CT scan done for this patient. And as you can see in this slide, this is another image of CT scan, brain CT scan. There is another white shadow, which is showing uh, left frontal ICH, intracranial hemorrhage. And as it was really vast, it was really extended, had a high volume, neurosurgeons had to transfer patient to operation room and have a craniotomy on him and evacuate the blood from his brain. Uh, as you may know, the sides are vice versa in brain CT scan. And when you are looking at the CT scan, the left side is in fact the right side of the brain, and the right side of the image is in fact the left side of the brain. So I thought that this may be interesting for our young colleagues. So the patient was hospitalized really long in ICU, and as you may know, the risk of blood clotting, DVT, deep vein thrombosis, and risk of blood for being clotted in the body is really high when someone has less movement, has less activity. So the physicians started low molecular weight heparin, LMWH, for the patient, and uh, the patient was receiving it, in fact. So there is a hypothesis that when we inject LMWH or heparin to patient, the blood uh, has less chance for being coagulated, and at the same time it increases the chance of uh, bleeding events. So the patient fortunately was discharged to rehabilitation center after 3 weeks of operation, and uh, he was not fortunately expired. And I borrowed this case from the article published by Banger et al. In Brain Behavioral Immunology Journal. Okay, it's the second case. As you know, uh, we have noticed the relation between ICH and IVH with COVID-19 through these case reports by help of these case reports, by information presented by physicians, other scientists in some kind of case reports. So this is another patient from the same case report by Banger. Uh, I should talk about an important topic. Uh, when scientists are reporting a series of diseases, a series of patients with the same kind of disease, with the same kind of problem, it is called case series. When you report usually more than three patients in a case in an article, uh, you are in fact trying to present a case series because it's made of a series of cases, a series of patients. In Banger and colleagues article, which was a case series, there was about 5 patients with the same condition, with ICH following uh, COVID-19. And so uh, I just selected 2 cases from their case series. The third case is a 54-year-old female uh, who had a 2-week history of cough before attending to emergency department, and also she had history of multiple deep vein thrombosis, multiple DVTs. So she had several DVTs several times before, and pulmonary embolisms. When the blood clot moves from the deep veins in our leg to heart, and then it is pumped to the uh, lungs, it causes pulmonary embolism, which makes the breathing really hard, which keeps the lungs from proper exchanging of oxygen with blood. So our patient, she had several DVTs and pulmonary embolisms, and such kind of patients should always, uh, you know, uh, consume some kind of anticoagulant drugs such as aspirin, and in severe cases warfarin is a good choice. So um, the chief complaint of patient was sudden onset of dysarthria and left-sided hemiparesis. Dysarthria is a situation in which the patient cannot talk properly. The patient loses the ability to talk in a way that other people understand him or her. Um, and then the hemiparesis is a condition in which the limbs, upper and lower limbs, have some kind of weakness in them. They they currently can be moved by the patient, but they have not the full force, the full energy, the previous energy for doing jobs. And it is called hemiparesis. And also Glasgow Coma Scale, or GCS, which is showing us the level of consciousness in a patient, and we usually, as physicians and neurosurgeons, use GCS or Glasgow Coma Scale as a tool for assessing patients with traumas, head traumas, and etc. The GCS for this patient was 13. The highest score for GCS is 15, and every one score drop in GCS is really important for physicians. So the patient had a GCS of 13, and the CT scan examination was done because the patient had, some sign of uh, neurologic signs, some kind of brain events, as I told you in previous slides. Showed the CT scan showed frontal lobe ICH, and the CT scan image here is, misplaced with the previous slide, and it is as just like the previous slide is wrongly placed here, but the CT scan of the patient also showed a right frontal lobe ICH. So but it was not too big. It hadn't, high volume to be needed to transfer patient to operation room. The ICH or intracranial hemorrhage in this patient didn't need surgical action. So uh, physicians uh, decided to start prothrombin complex concentrate, as we say PCC, or vitamin K, which have the role to reverse the effect of warfarin and some kind of such kind of anticoagulant drugs. You may know that warfarin uh, inhibits the activity of vitamin K in our body, and so leads to anticoagulation. And after this anticoagulant therapy, patient was admitted to acute stroke unit and for rehabilitation. And fortunately, this patient also got discharged after 2 weeks of admission and is not as healthy as before, but she is fortunately alive and trying to get better. خب. Okay, I just use a Persian word which means خب, means okay. Uh, I'm going to talk about our own cases. We also had similar cases in our department, in our neurosurgery department. As the article is under drafting and it is not published completely, I have not the permission to talk about the details of our patient. But we also had about 6 to 7 cases like the cases I have talked to you about so far. And unfortunately, we found that the mortality rate, the chance of dying for these patients is relatively high. And patients with ICH and IVH were treated more easily before the pandemic and before the COVID-19 infection. But nowadays, patients with ICH and IVH, especially those who are affected by COVID-19, have a higher chance of death. And the last slide is a systematic review which has recently been published by Sheriot and his or her colleagues in Neurological Sciences. It has been published from November the 3rd, and so it's really new. Uh, in this case, in this systematic review, which is systematic reviews are used for uh, assessing a general assessment or of all the current publications, all the current articles, for drawing a special result, for reaching to a special and confirmed conclusion about something that is controversial among scientists. So in this systematic review, uh, the researchers found 23 articles, 23 studies with 148 patients. And a pooled incidence of ICH in COVID-19 patients was 0.7%, which is relatively low, but it is really important. The pooled incidence means that the overall incidence, after assessing and doing a meta-analysis, doing further analysis on all of these 23 studies and all of these 148 patients, they reached to the incidence of 0.7 for uh, uh, ICH or IVH, intracranial hemorrhage, hemorrhaging events in COVID-19 patients. Uh, Most of the hemorrhages were occurred in elderly male patients, and also the systemic hypertension was the most common cause of this kind of events. Hemorrhage in multiple compartments, as I have talked about in the first slides, was prevalent in 9.5% of the patients, and the other patients, rest of the patients, had hemorrhage events and bleedings in the a single compartment, for example, epidural, ventricle, and etc. About half of the patients were using some kind of anticoagulation drugs, as I talked about, for example, aspirin, warfarin, enoxaparin, heparin, and all of them. And intraventricular hemorrhage, or IVH, was really common, was uncommon, the least common event in patients, which was 1.4%. Also, unfortunately, mortality rate in COVID-19 patients with ICH was about 48.6%. I should add this, that in our study, in our own study, the mortality rate was much higher, and unfortunately, we lost most part of our patients, most of our patients with COVID-19 and brain hemorrhages. And thank you so much. That was my presentation. I want to thank my dear professor, Dr. Saeed Ali Ahmadi, who is a neurosurgeon in Iran University of Medical Sciences, and also Dr. Jaber Hatam, who is Chief President of Neurological Surgery in Iran University of Medical Sciences. And also, I want to thank Dr. Hossein Masoudi and Dr. Mohammad Reza Abbassadeh for planning this presentation and event, and all of my friends in Sechenov University, Sechenov International, and all of you, my friends. Uh, Thank you so much for listening to my presentation. I'm at your service if there are any questions, and I ask my friends, Dr. Abbassadeh and others, to tell me about the questions, and I can answer them really happily. Dr. Abbassadeh, please send me questions if there are any questions. Okay. Okay. I'm still waiting for my friends, Dr. Abbas Sadeh, to tell me about the questions. Uh, uh, Let me see the questions, please. Okay. Uh, I have received some questions. My friend uh, has asked me, do type 1 and 2 hemorrhages require hospital admission? I think he or she means, subdural hematoma, or uh, she means or he means this. For subdural and epidural hematoma, uh, you know, uh, we really don't need admission in every patient, in all of the patients. We have a scale for assessing the patients, and if our patient reaches a high score in this uh, scale, then she or he will need admission. But if the score is low, we can manage patient with conservative treatment, with just prescribing drug in the hospital. But not all of the patients need, operation, surgery, but some of them need admission and some of them can be treated in home, just like outpatients. Yes. And also another question. So heparin did not prevent the formation of hemorrhage in his brain, if that was the aim. The aim of heparin is to preventing the blood from being clotted, is to prevent blood from, uh, you know, uh, being clotted inside the blood vessels. If we have clots in our blood, so the blood supply will be altered in a patient. So the aim and mission of heparin is to not let the blood being clotted. Okay, so heparin was doing his or her mission um, really good, but we must, kind of uh, adjust it in the body. So the heparin itself may have caused the hemorrhage in the brain. The, this is the uh, the usual effect of heparin for not letting the blood to get clot, but sometimes this advantage becomes disadvantage. I hope I'm describing it in a good way. And also I have another question. What is the darker shadow located on the left side of the brain on the CT of the patient in case 3? I think that you mean the ventricle. Ventricles, as they are uh, empty spaces and full of CSF, a fluid, cerebrospinal fluid. Uh, they usually have a dark shadow in CT scan. This is the cause. They are ventricles. Thank you so much, my friend. They have thanked us for the webinar. And another question, please explain about what is the most of brain so danger in COVID-19. Could you please, my friend, repeat your question? I did not really got uh, your question. Amir Reza, is if you're still with us, please uh, ask your question one more time. Okay, I got the Amir Reza's question. Uh, he means that what part of the brain is more damaged by COVID-19? It's a really good question, but we don't really know much about it. Why? Because there are not enough case reports, there are not enough patients who have been assessed for this. As the pandemic goes on and as we have more patients uh, with ICH, and I hope, in fact, that we do not have more patients with this problem. But as the pandemic goes on and we have more patients with this condition, then we may have notice about this. But as I have told you in the last slide, in the uh, about the systematic review, it seems that intraparenchymal hemorrhage (IPH) or in the hemorrhage inside the brain tissue is occurring more common than other parts of the brain. Also, we do not have enough information about the most prevalently affected lobes, but we may understand it in the near future. Yes, heparin can have severe uh, uh, problems, can cause serious side effects in patients, and we usually we always start prescribing heparin in the hospital, inside the hospital, when the patient is hospitalized. And if we are going to discharge the patient, we prescribe the other types of anticoagulants instead of heparin, the oral anticoagulants, for example, warfarin. Okay. Uh, Thanks a lot for your nice questions. I think that there are no more questions in the chat box. So I think that I can uh, finalize this session. Another time, I want to thank my friends in Sessionova University and also thank my dear professor, my colleagues, and all of the healthcare team all around the world for doing such efforts, such sacrifice for fighting with COVID-19. And I hope the pandemic to be ended very soon. Thank you so much again, and I wish healthy days in front of you, my dear friends. Thank you so much for paying attention to the session. Thanks a lot, and goodbye.